Hello and welcome. In today's video, we will be discussing some important and interesting pharmacology MCQs that can be extremely helpful for exams like SPL, MOH, DHA, and other foreign pharmacist exams. Number 1. Which of the following is the most common mechanism of action of beta blockers? A. Blocking calcium channels in smooth muscle. B. Inhibiting beta adrenergic receptors. C. Stimulating alpha adrenergic receptors. And D. Increasing release of norepinephrine. The correct option is inhibiting beta adrenergic receptors. Number 2. The bioavailability of a drug administered intravenously is A. 0%, B. 50%, C. 75%, and D. 100%. The correct option is D. 100%. Number 3. What is the primary enzyme involved in the metabolism of warfarin? A. CYP2D6, B. CYP3A4, C. CYP2C9, and D. CYP1A2. The correct option is C. CYP2C9. Number 4. Which type of drug interaction occurs when one drug enhances the effect of another without directly interacting with it? A. Additive interaction. B. Synergistic interaction. C. Antagonistic interaction. And D. Pharmacodynamic interaction. The correct answer is B. Synergistic interaction. Number 5. Which of the following is an example of a drug with a narrow therapeutic index? A. Ibuprofen. B. Digoxin. C. Paracetamol. And D. Amoxicillin. The correct option is digoxin. Number 6. What is the antidote for acetaminophen or paracetamol overdose? A. N-acetylcysteine. B. Atropine. C. Flumazenil. And D. Naloxone. The correct answer is N-acetylcysteine. Number 7. Which of the following antibiotics inhibits bacterial protein synthesis by binding to the 50S ribosomal subunit? A. Penicillin. B. Ciprofloxacin. C. Azithromycin. And D. Doxycycline. The correct answer is azithromycin. Number 8. A patient with diabetes mellitus is prescribed metformin. What is the primary mechanism of action of metformin? A. Stimulating insulin release from beta cells. B. Decreasing hepatic glucose production. C. Inhibiting intestinal glucose absorption. And D. Activating insulin receptors. The correct answer is decreasing hepatic glucose production. Number 9. Which of the following drugs is contraindicated in a patient with asthma? A. Montelukast. B. Salbutamol. C. Propranolol. And D. Ipratropium. The correct answer is propranolol. Number 10. In which phase of a clinical trial is the primary focus on drug safety and tolerability in a small group of healthy volunteers? A. Phase 1. B. Phase 2. C. Phase 3. And D. Phase 4. The correct answer is Phase 1.